I can acknowledge my mistakes. I'm sorry. I hate to admit this. A lot of doctors will tend to confuse our patients. I've seen a lot of my clients, and most of the times they don't even know what their doctor just told them. Like everything their doctor told them to do, they can't even remember it. And now this has actually helped me to actually talk to my clients like I'm talking to a friend so they can really understand what I'm talking about. Most of them have done their research before they come to the clinic and it's easier to talk to them about, but a lot of them don't really know because they are seeking for solution and options with their hair loss. So now I'm going to be telling you 5 simple terminologies or 5 simple things we talk about in hair transplant that we don't need all these big words, but I'm just going to break it down for you. And now, if you're coming across this video for the first time, my name is Dr. Echefu. I'm a hair transplant surgeon, a hair loss coach. I've helped thousands of my clients regain confidence through hair regrowth and hair transplant. Now, let's stop right here before we go ahead with this video. If you're dealing with hair loss, you've been watching my video, trying to make up your mind about what to do about your hair loss or hair thinning or your bald. Now, the simple thing I always say is that let's just start with a virtual consultation. It's free. We offer it 7 days a week. Now, if you're busy on a weekday, go ahead and make the appointment for a weekend. If you're busy on a weekend, go ahead and make the appointment for a Friday or a Thursday or a Wednesday. So you don't have any excuse from not actually taking a step on finding out what is going on with your hair loss. So if this is you or you know someone dealing with hair loss, send them this video. Tell them it's time to make the appointment or you make the appointment. Now I'm going to give you 5 big words that we really don't need to use those big words. I'll just break it down for you so you can understand it. So anytime you go for a hair consultation or they're using all those big words or you're reading it online, you say, hey, you heard it from Dr. Echefu first. This is easy. Let me explain it to you. Number 1 is what type of hair transplant surgery are you going to do? I keep hearing this FUT, FUE, DHI, robotic surgery. Dr. Echefu, there are so many words. How do I know which is which? Now, don't think about it anymore. Let me just give you, there are only 2 types of hair transplant. FUT, remember the T in strip surgery. They are just only taking a strip of skin that has hair so they can use it to transplant to the area of hair loss. That's all you need to know, strip of skin. And if you haven't watched my video on what kind of hair transplant that you need, go on YouTube and watch all my videos. I teach you simple tips and tricks on how to know which hair transplant works for you. Now, when we hear about FUE, from the name is follicular unit extraction. Scratch that word, it's a big word. What it only means is that we are extracting with our machine individual follicles. So instead of doing a strip of skin, we are basically using our machines to extract those follicles so that we can transplant it to the area of hair loss. Now, next question is, then where does this robotic hair transplant, micrografting hair transplant, DHI, all of them use the concept of FUE. Understand that. 2 types, FUT, FUE. Every other thing falls under FUE. Simple. So don't let those words deceive you. Remember, I have a video on don't fall for the hype of machines. If you haven't watched those videos, go to YouTube, watch those videos. YouTube name is Dr. Echefu. I promise you'll thank me later. Now, the second big word we use in hair transplant that we don't need to be using that for our patients or clients is, what is the donor area? Now, donor area, I want you to think about it like your savings account. So you're dealing with hair loss and you're a candidate for hair transplant and your hair surgeon says, hey, your donor area is good or your donor area is not good. The donor area means where are we going to get the hair that we need to transplant to the area of hair loss, period. I don't want to think anything more about it, okay? So we have several donor areas. The back of your head right here, your chest area, your arms, your legs, your beards. So I want you to think about all those donor areas as a bank account. So whatever your hair transplant surgeon is talking about, they're just trying to figure out which donor area or which bank account has enough hair for us to take or has enough money for us to take so that we can transplant it, period. I hope this has simplified things for you. And number 3 big word we always say in hair transplant word that we really don't need to be using it. I hate using that word, shock loss. Most of my clients panic about shock loss. But I always have to explain what shock loss is. It's just a period of time after hair transplant. I typically call it the lazy family syndrome. What is the lazy family syndrome? Those your lazy family members that have been resting, trying to betray you. Something happens and they are shedding, they are leaving, guess what? You won't miss a thing. So it's the same thing. Like, your hair is shedding. Now, does it mean you're going to have hair loss after the hair transplant? No, it's just a shedding period. But after a couple of months, your hair is going to grow right back. So you don't need to panic or you don't need to stress about it, because stressing can actually make it worse. So all you need to do is follow your post-op instructions and watch your hair grow in the next couple of months. So the next big word people tend to confuse is a graft versus hair. So I'm going to explain what a graft is, okay? Just imagine I give you a packet of candy, okay? So a graft is that packet. Now that candy might have one candy in it, or two candies, or three or four candies, same thing. So a graft is the packet, then the hair is the number of candies in that packet. So do you understand? So when they say 4 hair grafts, 3 hair grafts, 2 hair grafts, 1 hair graft. So do you understand? Graft, packet, hair is the candies in it. So when you're going for a hair consultation for hair transplant and they tell you you need 2,000 grafts. So remember, 2,000 packets of candies. Each packet might contain 1 candy or 2 or 3 or 4. Okay? So even if they tell you you need 1,000 grafts, in total, you might get almost 5,000 or maybe 3,000 number of hairs in those grafts. So you see, and that's why Havila Hair Restoration, we focus more on area of hair transplant, or we focus more on area of hair loss, and we can calculate the number of hair you need to give you a good coverage and not the grafts. Because sometimes when you harvest a lot of grafts, imagine harvesting a lot of packets, your good hair, and it can lead to over harvesting. So I think the best way is to calculate the area of hair loss, then figure out number of hair you need to cover the area of hair loss to give you a good visual density. I hope you understand it now. Don't get it confused next time. So the final big word we use in hair transplant world that I don't think we need to be using is you are not a candidate. That is a big word and also a blanket statement. When your hair transplant surgeon tells you you are not a candidate, I'm going to give you a couple of scenarios or a couple of reasons why you are not a candidate. Number one, your donor area is not good. You see, donor, remember I told you about having a savings account. That savings account, you don't have enough money in it. So your donor area is not good. That's why they say donor capacity. Your savings account is not good. Number two, you might have scarring alopecia and you are not a candidate for hair transplant right at that moment. Scarring alopecia, that means you have some inflammation going on that needs some treatment, medical treatment, before you become a candidate for hair transplant. So another reason why you might not be a candidate might just be you need to start medical treatment first and have a reassessment or reevaluation before you become a candidate for hair transplant. So in summary of what I've said, 5 big words in hair transplant world you don't need to know about, but you need to know about it because if you're thinking about a hair transplant, you need to know what we're talking about. As number one is what type of hair surgery or hair transplant surgery you're about to do. Either is FUT or FUE, T for straight. FUE is every other thing. Number two is your donor area or donor capacity. Think about it as a savings account. You need to know what savings account, which area of the savings account, and do you have enough money for hair transplant? You see? And number three is the shock loss. Think about shock loss as those lazy family members that have been resting that will betray you after your hair transplant. Just think about that. Number four is grafts versus hair. Think about packet versus candies in the packet. Okay? And finally, you are not a candidate. That is a blanket statement. There are a couple of reasons why you are not a candidate, so ask that question. It might be for several reasons. Now, I want you to do me a favor. Now you've listened to this video to this point, I want you to do me one simple favor. Next time you go for a hair consultation or hair transplant, and your hair transplant surgeon is saying all these big words, I need you to say, yeah, I got it. I understand it. Yes, I understand it because you've watched this video. Now, if you're dealing with hair loss and you're thinking about a hair transplant or you don't even know your option, first step is to make an appointment with us. Yes, I say it all the time because that is always the first step. I do not recommend any medical treatment or medical therapy online. No, you have to have a formal consultation. That's the right thing to do. And that's why we created a virtual consultation so that somebody can talk to you. So make that appointment. We offer free hair consultation 7 days a week. Someone from my team will get in touch with you, talk to you, and talk to you the next step you need to take regarding your hair regrowth journey. Now, if you've loved this video, I'm sure you're going to love every other of my video on YouTube. YouTube name is Dr. Echefu. I teach you simple tips and tricks concerning hair regrowth and hair transplant. Let me tell you something else you need to know. I promise you, you won't hear it from any other person. Until next time, stay safe. Bye-bye.